So welcome everybody today. Thanks for joining us to this webinar, which is Living Kidney Donation Back to Basics. For those of you who don't know me, my name is Jan Shorrock. I'm Executive Officer for the charity Give a Kidney, who are hosting today's webinar. So you're all very welcome. And if you're watching this later on YouTube or on social channels, you're also very welcome. But you unfortunately won't be able to participate in the Q&A that I'm going to talk about in a little while. So for those of you who don't know Give a Kidney and maybe new to us, we are a UK-based charity, and our remit is to raise awareness of living kidney donation with a particular focus on what we call non-directed living kidney donation, and we'll talk about those terms in a little while. We aim to support donors who are going through the process or thinking about going through the process, or who have been through the process, and we also spend a lot of time kind of advocating for positive change in the living donor journey in the UK, and work very closely with colleagues and partners in trusts, transplant trusts across the UK, and with NHS Blood and Transplant. So we're very grateful to our speakers today. So we're going to be joined by three of Give a Kidney's trustees, Paul, Caroline and Adnan. We're very grateful to them for giving up their Saturday mornings. In a moment, I'll ask them to introduce themselves to you. And we're going to try to really keep this as basic as we can, as clear as we can, because we know there's quite a lot of sometimes complex terminology, words that we're all very familiar with, but can be a bit daunting for people who might be new to the subject of living donation. So we really are going back to square one. We're here to answer your questions. We've got lots of questions we've prepared already from things that we know we get asked very often at Give a Kidney and the transplant units. Thank you to the speakers also for their help with that. If you would like to ask any questions in the audience, on your screen, at the bottom of your screen, there should be a section that's labelled Q&A. So if you click on that, you should be able to type a question in, and you can choose to remain anonymous should you wish, or you can leave your name there, and we'll try to answer as many of those questions as we can. There are no silly questions. We're here to kind of answer anything that might be on your mind if you're thinking about donating or have donated. So please feel free just to ask anything you would like to, and we'll do our very best to answer as many of those as possible. If you're on a tablet or a phone, you might have to tap your screen to show that Q&A, to show the toolbar with the Q&A section. I think that's probably all from me. So I'll just firstly ask Paul, Adnan and Caroline to introduce themselves. So can we start with Paul, please?
Morning, everyone. My name is Paul Gibbs. I've been associated with the charity since its inception in 2011. And my reason for being here is I'm a transplant surgeon in Portsmouth, down on the south coast. And we've always been a very pro-altruistic, non-directed altruistic donor unit, and it's a pleasure to be here. Thanks for the invite, Jen.
Thank you. Adnan?
Hi everyone, my name is Adnan Sharif. I'm a nephrologist, so that's a kidney specialist from a medical point of view, and I work in Birmingham. And I've also been involved with the charity for probably going on about 6-7 years. Firstly, from a kind of just providing medical input from a kidney specialist perspective, and then recently as a trustee.
And Caroline, please.
Hi, good morning everyone. Thank you, Jan, and thank you for inviting me to talk in today's webinar. I've been a living donor coordinator for over 15 years at Sheffield, and it's been amazing to see non-directed and directed altruistic donation increase over the years. And I'm really excited to be talking about it today.
Thank you all. And I should also say that I'm a living kidney donor myself. So I'm somebody who has been through that process sometime about 10 years ago now. It's quite a long time ago. But I can answer any questions from a donor perspective, as you know, somebody who's actually been through that process myself. So if you've got any questions about that I could answer, then please do ask me as well. So we've already heard some kind of terms this morning around living donation. But actually, we're going to start right at the beginning. And I'm going to just throw some questions out to the panel as we go. We've heard living donation, we've heard altruistic, we've heard directed, we've heard non-directed. So we will talk about those terms to clarify what they mean as we go through the process. But firstly, I mean, really back to basics, Adnan, maybe you could talk a little bit about, very briefly, what is a living donor, and what is a donor, what is a recipient?
Sure, no problem. So, as a kidney specialist, I look after people with kidney failure. And when you've got kidney failure, your treatment options are either dialysis or transplantation. And for people who are fit enough to receive a kidney, and we call them the recipients, their best option is kidney transplantation. And kidney transplantation can happen in two ways. You can receive a kidney from a deceased donor. So this is where you have your organ donor card, where you sign up to an organ donor register. And if you die in certain circumstances, you can give your organs after death, and we call them deceased donors. But you can also be a living donor. And in the UK, this is predominantly people who will donate a kidney. Less common are people who will donate a part of their liver. And over 95% of living donors are usually kidney donors, and we call them living donors. And anyone can be a living donor, and they have to go through a kind of a very careful process, and those will probably be some of the questions that we will go through. But certainly from a kidney specialist perspective, we really encourage living donation, because if you do have kidney failure, receiving a living donor kidney is your best treatment option.
And Adnan, why do we, if people have donor cards or have signed the organ donor register and can donate as deceased donors, why do we need living donors? Do we need living donors?
Yes, well, we definitely do need living donors, and sadly the reason for that is because there simply are not enough donors, and not just the UK, but every country in the world. There's a gap between the supply of organs and the demand for organs, and unfortunately we are no different. And even though there's been lots of initiatives, people know that we've now got an opt-out system in the majority of the UK, there's still not enough donors for the number of people who need transplants, and especially kidney transplants. And from a kidney transplant perspective, we know that every day 2 or 3 people will either die waiting for a transplant, or they will be removed from the waiting list, and they're usually removed because they are no longer fit enough to receive a kidney transplant. Because the wait for a kidney transplant, well, it has got a little bit shorter over the last decade. It's still about 2 to 2.5 years, and for some people it's even longer, especially if they've had previous transplants or people of kind of ethnic minority background. So we do still need living donors because of that gap. The other reason why we need living donors, as I mentioned, it's the best treatment option for kidney failure patients. So for some people, they may be too high risk to receive a kidney from the waiting list, but if they receive a living donor, because it is associated with better outcomes in the short term and in the long term, often that's the only way that some people will get a kidney transplant.
Thank you, Adnan. So maybe over to Caroline briefly, just to say, so who can be considered as a living donor?
Any adult in good physical and mental health can be considered as a living donor. Before starting the process, you will be asked about your past medical history, and some conditions and diseases such as diabetes, uncontrolled high blood pressure, and some cancers can preclude donation. There's no upper age limit, and some donors have even donated in their 80s, but it's also it's very important as a kidney donor that you've got a healthy lifestyle, and that includes a healthy weight.
Yeah, thank you. So probably back to Adnan a little bit. So if somebody steps forward to donate a kidney and goes through the assessment process and that transplant is successful, how long would you expect that kidney to last in the person who receives it?
So, I mean, a living donor kidney, on average, we would normally say should last between 20 to 25 years. And you can compare that again, the kidney from the waiting list. So a deceased donor kidney, which on average we will now say would last between 15 to 20 years. So it will last longer. And, I mean, we've got some people who received living donor kidney transplants, going into kind of 30 years, 40 years. I think we have one person in Birmingham whose live donor kidney is older than me. So it's there's a wide spectrum, but on average we're talking about 20 to 25 years, and that's that's a long period of time. Especially when you compare that to the alternative, and the alternative, unfortunately, is being on dialysis.
And what is dialysis, Adnan?
So, I mean, in complete layman's terms, and I think this is the bit where sometimes we're bad at not talking about layman's terms. It's basically it's like being connected to a washing machine. That's often what we explain to people. Your kidneys have a job to do. I guess I'm biased. I think the kidneys are the most important organ in the body, but they do lots of jobs. But the job that most people understand is that they clean your blood. So they constantly are filtering the blood. All the rubbish that your body produces, it just gets spilt out into your blood. And your kidneys will do the filtration. So they'll keep a hold of all the good stuff and get rid of all the bad stuff. And all the bad stuff that your kidneys get rid of get passed out as urine. Now, if your kidneys aren't working, there's a few other things that your kidneys do which will not function properly. But the main thing is you're not getting rid of all the toxins from your blood. And therefore, when you've got kidney failure, which means that your kidneys can no longer cope, that's life-threatening, and that's when you need some kind of treatment. Now, what dialysis does is essentially connect you up to a machine. There's two types of dialysis. The commonest type is hemodialysis, and that is where essentially we just need access to your bloodstream. You get connected up to a machine, and essentially all the blood comes out, gets cleaned up, and the cleaned up blood goes back in. And that is something that you would need for 3 times a week, 4 hours every time. There is another type of dialysis which is called peritoneal dialysis, and that's where you have a tube in your tummy, and essentially you can do the same thing. You can try and clean the blood, and again, that's something that you have to do on a daily basis. So it's a big commitment, doing dialysis, and it impacts on people's quality of life. There's lots of problems that people have, and certainly the survival for people on dialysis is nowhere as good compared to having a kidney transplant.
Thank you. So a transplant, a good quality transplant, really is life-changing for the person who receives it.
Without a doubt, yeah.
Yeah, and massively improves quality of life as well.
Absolutely.
Being connected to a machine, but when you think about kind of lifestyle and work and all those family commitments, to be going potentially to a hospital 3 times a week for 4 hours at a time, the travel time, parking, all of that is a massive commitment, isn't it?
Yeah, I mean, it's a massive commitment. I mean, we often, I mentioned, for example, the hemodialysis, which is the commonest type, that, it's 4 hours 3 times a week. But it's not just 12 hours of your week. It's it's the travel time, it's going there, it's the waiting around, being connected, the wait afterwards. Some people don't feel well before their dialysis. Some people feel literally washed out after their dialysis. Some people on a non-dialysis day may be able to do some things. Others just feel absolutely knackered, and then the day after they're feeling a little bit better, but then you're back for dialysis again. And if you're young, school, employment, traveling abroad, all these things which impact on quality of life are all affected by dialysis.
So I think we've explained why living donation is important, and maybe let's talk a little bit about the different types of living kidney donors, because we've heard the terms already, directed and non-directed. We've heard the word altruistic. So maybe Caroline, if you could explain the difference between those terms. It can be a bit confusing, but bear with us.
So you can donate to someone that you are genetically or emotionally related to, so a family member or a friend, and that's called a directed donation. You can donate to a stranger, and that is called non-directed donation. You can donate to a specific person that you don't know. For example, someone that you might have seen on a social media campaign. And this is called directed altruistic donation. You can also donate into the kidney sharing scheme. This is a national scheme where uncompatible pairs are registered. So this is where it gets a bit complicated, but I'll try and explain it simply. So if you've got, for example, a husband that wants to donate to his wife, but he's not the right blood group, the scheme allows us to be able to assess the husband And if he passes the assessment, the pair are registered in the kidney sharing scheme. And every 3 months, there is a matching run with a hope that that pair would be matched either with another pair or even 2 pairs in a 3-way exchange. So the kidneys are swapped and the recipients all receive a compatible kidney transplant. So as a non-directed donor, you can donate into the kidney sharing scheme. So you would register in the scheme and you would donate to a recipient of a pair, and their donor would then potentially donate to another recipient of a pair. And then finally, to end the chain, the donor from the last pair would donate to someone on the deceased donor list. So that's someone waiting for a deceased kidney that hasn't got a living donor transplant, which is really amazing, because that means that that non-directed donor has potentially created 3 transplants through their donation.
Yeah, it's an incredible scheme. The way I always think about directed and non-directed, so non-directed is essentially like the scheme in which you would give blood. So you would go and give blood, you don't know where it goes, it just goes to somebody around the UK who needs that blood, whereas directed goes to somebody specific. It's being directed to a specific person that you're aware of. For the sharing scheme, we have a whole other webinar about. It's on our YouTube channel, and we go into great detail on that. So if that's something you're interested in finding out more about, very difficult to explain simply, but we did a whole kind of hour and a half on it. So if that's something you're interested in, then do check our YouTube channel, and you'll see the webinar on the sharing scheme. Let me just have a quick look at the Q&As to see what we've got. Okay, that's a very technical question, so I'll ask probably Adnan to come to that one in a little while, but we'll just, for the moment, we'll just carry on with the living donation kind of more basic questions. So assuming that you either have somebody who needs a kidney that you would like to be assessed as a living donor for, or thinking about being assessed as a living donor for, or you might want to just donate to somebody on the waiting list, very much like you would give blood. What does that involve, Caroline? What's that assessment process like? What happens?
So it's a lot of tests. Each transplant centre will do the same test, but potentially in a different order. But we all follow the National Living Donor Guidelines. So I will discuss the test just briefly, but please go to the Give a Kidney website where the tests are explained in more detail. So if you pass the initial screening of your past medical history, we would offer an initial assessment, which I class as kind of like an MOT, where you would come into the transplant unit and you would have a series of blood tests, so one needle, but a series of blood tests testing liver function, kidney function, a virology screen. You'd have a heart tracing and a chest x-ray, your blood pressure and your weight, and urine tested. So nothing invasive, and then those tests would all be reviewed by the kidney doctor. And in Sheffield, we would then offer a counselling session to inform potential donors of the pathway of becoming a living donor, the surgery, the recovery, living with one kidney, the risks associated with donation, although minimal, follow-up after kidney donation, and issues like travel expenses. We would then, if the donor still wants to proceed, we would offer a one-stop assessment day where the rest of the core tests are offered in one day. Again, different centres will do the assessment in different varying ways. At our one-stop day, we do a kidney scan, a very accurate measurement of kidney function, and a review by our surgeon and kidney doctor. We then review the results. If you are coming forward as a non-directed altruistic or directed altruistic donor, you would need a psychology assessment during the process. We would then bring you back to clinic and go through the results, and the outcome could be that you need to have further investigations, that we decline you as a donor, or that we accept you as a donor. And if we accept you as a donor, you would need to be then seen by the independent assessor, and the independent assessor reviews you to make sure that you're not being paid, that it's an unconditional gift, and although the risks are minimal, you're aware of them and you're willing to proceed. And then the independent assessor will write off to the Human Tissue Authority for us to get legal approval for you to donate.
That's a lot, isn't it? I think,
Yeah.
Yeah. So, I think from what Caroline's saying, it's really clear that there's quite a lot of commitment from the donor in terms of going for all those tests, getting time off work or time out of whatever responsibilities you might have. So how long does that process usually take on average?
That's a really difficult question, and everyone asks it. Ideally, we would love to say it would take about 3 months, but it would all depend on what the tests find, and if you need further investigations. So it's really important when you start the process to understand that being screened as a donor is significantly different than having your health tested, because if we do find a slightly borderline result, we have to investigate that so we can leave no stone unturned, because it's got to be absolutely minimum risk for the donor to have this operation. So for example, if there was slightly abnormal heart tracing and you needed a cardiac assessment, then we would have to refer you to the cardiologist, which obviously can take a long time. So sometimes we just can't say how long it's going to take in total. It's all dependent on what the tests find, but we try to do it as quickly as possible.
Yeah, and I guess one of the risks of going through the test is actually you might find some health condition that you were previously unaware of. Of course, then that can be treated. So we have heard examples, certainly through Give a Kidney, of somebody who has actually, through going through the assessment process, discovered a cancer that they were unaware of that was then able to be treated. But of course, that could preclude you from donation. And actually quite a lot of people who are generous enough to step forward actually don't get through the test. So it is a very rigorous testing process to make sure that the donor is as Caroline said, as fit and well, and the risk to them are as low as possible. But there is a risk that you actually may not go to the end of that process. And I suppose the other thing to say on that also is that the donor actually at any point through that process can also choose to withdraw from the process, and that's made really, really clear from day one, really, that up to the moment the anaesthetist puts you to sleep, you can actually decide to withdraw, and your wish would be absolutely respected by the transplant team or your care team. But maybe that's time then to talk about actually what are the risks. This is a surgery. It's a surgery that you don't need for your benefit. So I think this is probably for both Paul and Adnan. I don't know how you want to work it out between you, but can you talk through the risks of becoming a living kidney donor, please?
Adnan, do you want to go through the medical long-term ones first?
Yeah.
And then
I'll talk about the medical risks, and I've just answered the question in the Q&A, and I think it kind of follows on from what Caroline says. I mean, a lot of our donors will often come with certain health issues, and the job of the kidney specialist will be to essentially go through that and work out whether an individual can be a donor. And as much as we're very keen to obviously promote living donation, we often say to our patients who will be the recipients that, of course, we really want you to receive a kidney, but the well-being of the donor always comes first. And there's so many medical conditions out there that often for things like ankylosing spondylitis, we do need to have a very careful review. But with regards to the risks of donation, I mean, firstly, the risks are there. They're very, very small, but they are there. And obviously they will vary for different people depending on what their backgrounds and health issues are. But the risks that we often talk about to individuals is that when you have two kidneys and one is removed, your remaining kidney will beef up how much work it does. So if we assume that you've got two kidneys, and sometimes we do find out when we're doing these processes. I think Jan mentioned sometimes you do come up with little curveballs, and sometimes people will find out that actually they've only been born with one kidney. But if you have two kidneys and they both work equally, on the day of your donation, your 100% kidney function drops down to 50, and then over the space of the next maybe 6 to 8 weeks, your remaining kidney will actually beef up in both size and how much work it does. So you will actually end up around about 75 or 80% of your starting level. So there has been a little bit of a drop, but it's not down to 50. You kind of back up to about 75, 80. Now, in the long term, what does that mean? Well, it means that, one, there's a slightly higher risk of your blood pressure being a little bit higher, and that's why uncontrolled blood pressure, as Caroline mentioned, is one of the reasons why we will often say no to somebody donating. Because your remaining kidney is kind of working a little bit harder, the blood pressure does go up. Sometimes that also means that you may leak a little bit of protein in the urine. That's something that we always counsel all of our patients for. But as a kidney specialist, one of the most important things that we're looking at is what is your risk of developing kidney failure yourself in the long term. And I think of all the things that we focus on, this is probably one of the most critical things. And when you compare a living donor to the general population, the risk is much the same. In fact, some studies suggest it's a bit lower, but that's not a fair comparison because, as Caroline's mentioned, our living donors have gone through a rigorous MOT to be able to donate. So what I often say to patients is the best comparison for you as a living donor is that if we could clone you and your clone gets to keep their two kidneys and you give up one of your kidneys, what's your risk of developing kidney failure compared to your clone? And the risk is a little bit higher. It's very small, but the risk is there. But compared to a similar aged person from the general population, the risk is lower. So this is one of the reasons why we do want all of our living donors to kind of have an annual checkup where we do your blood pressure, we check your urine, and we do your kidney blood tests. And then for certain individuals, there may be other risks. So, for example, young women who may have donated have a slightly higher risk of things like gestational diabetes or gestational high blood pressure. But otherwise, from a medical point of view, those generic risks are fortunately very, very low.
Thanks, Adnan. So, I mean, surgery is an operation, and there are risks specific to that operation, and there are general risks. So if we start with the general risks, even having an anaesthetic is not without its risks. I think most anaesthetists will quote a 1 in 100,000 risk of an anaesthetic problem. So as you can see, that's incredibly small. And then there are issues around breathing problems and heart, but from what Adnan and Caroline have said, we know your insides better than you do when you get to an operation. So we would hope that most of those will get ruled out. And then there are risks that's specific to the live donor. There are 23 transplant units in the UK, and as far as I'm aware, all of them do the donor operation via one keyhole technique or other. So you don't get a big incision, but we do need to make an incision big enough to get the kidney out. And the size of the kidney is about the size of your fist. So if you think about putting a fist inside you, so you end up with an incision about this long. Different units do it in different places. My unit does it just underneath your belly button through a little incision. Some put it on one side or the other, but the general gist is the same size. You also have 3 or 4 little other cuts where the instruments go in to do it with the keyhole surgery. We do need to move parts of your bowel out of the way to get to the kidney, and then we need to mobilize the kidney and move it away from its structures, and then disconnect it from its major blood supply and disconnect the tube, which we call the ureter, which connects the kidney to the bladder. And this process takes, on average, around about 2 hours. Some people it takes less, some people it takes more, but an average from start to finish is going to be about 2 hours. The major point for us, the kind of pause before you go, part of the operation is when we're about to take the kidney out. And we have another surgeon stood by to receive the kidney, to wash the blood out of it, so it doesn't sit too long, and we call it off. And at that point, it's all very quiet in theatre, because it's the bit where we start dividing all the blood vessels. And that's about, an hour and a half, hour and 3/4 into the operation. Once the kidney's out and the other surgeon's dealing with it, it's then a case of checking that everything's intact. All the blood vessels have been sealed off. We then put the bowels back in place, and then come out and close the wounds. Obviously, you can't do surgery without scars, so you do end up with a scar, but in the vast majority of cases, it becomes barely visible over time. But wounds don't always heal up very well, so you can have pain and discomfort from the wounds, and occasionally hernias form where the muscles divide after the surgery and need a further operation. From a point of view of painkillers, there are various different techniques we use, and most of our donors now go home after 1 or 2 days of surgery with oral painkillers. It's changed hugely over my working lifetime, and donors used to be in hospital for 7 to 10 days with a big incision over the kidney on the left or right hand side of their tummy, and a lot of problems with the wounds. But this has changed out of all recognition with the keyhole surgery. As far as returning to work, that's quite an individual thing. All I would recommend, and I'm sure Caroline and Adnan would support this as well, the commonest complaint we have from donors is tiredness. And I think that's because they try and do too much too soon. Because the scar on the outside looks small and the pain settles, they forget how much work we've done on the inside, and it does take a lot of effort. And we really encourage people to try and rest up as much as possible. Which, people have busy lives, children, they may even have their recipient in the house with them. And that can be difficult to know whose responsibility it is to look after whom. So a bit of help, plenty of rest in the early days certainly helps. And from a surgical point of view, we will often see you at 6 weeks' time after your surgery, although most living donor coordinators contact their donors the day after they get home and are in regular contact and happy to receive calls. And then after the first 6-week appointment, we say get back to a bit more activity, start driving, start thinking about going back to work if you want to, although your return to work will slightly depend on what kind of job you do. Obviously, if you're office-based and sat in front of a computer, that's going to be slightly different from one of our donors who was a greenkeeper on a golf course, who obviously needed a little bit more time off work. And then we'll see you at 6 months, 3 months, 6 months and a year, just to check everything's fine. And then, as Adnan said, we will offer you an annual kind of 10,000 mile service where we check all your bloods. And we often suggest the patients go every year to their GP, but offset by 6 months. So they're getting checked out every 6 months or so. And that's something that we will offer for forever. And we regularly try and keep our donors in long-term follow-up, just so we can make sure that you're not the small percentage of people whose kidney's getting a little upset, so we can get on it early and control your blood pressure and look after things so you keep your one remaining kidney for as long as possible.
Thank you, Paul, and thank you, Adnan. I'm just going to cut to a couple of the questions that we've had on the Q&A, just because I think they might be relevant to more people in the future as well. So there was a question about can an adult donate to a child, which I don't know whether you want to just answer out loud, Adnan, just for the recording.
Yeah, sure, no problem. I was typing away the answers as well. So yes, an adult can donate to a child. Here in Birmingham, we've got the Children's Hospital, so we commonly do see that. It really just depends on the size of the child. I mean, usually beyond the age of 2 or 3, my pediatric colleagues would normally be happy. But yeah, it just depends on the size of the child. But it's one of the common living donor transplants that we do is parent to child.
Thank you. And a couple of questions around, well, firstly, how often are living donations successful? And is there a chance that the transplant won't work? Adnan or Paul? Adnan?
I can take that.
Yeah.
So I guess it depends on how you define success. If you look at kind of 1 year survival for the recipient, and then it's I think most centres in the UK we're looking at something like 100 or 99%, and kidney survival is very, very high. It's probably like 96, 97%. So obviously it's very, very successful, but buried in there will be the fact that there will be occasional cases where the live donor transplant is not successful, and there's a variety of reasons for that. There can be technical reasons, but it can also depend on the individual who is receiving that kidney, and that's something that is always counselled to both the person donating the kidney and the person receiving the kidney, that this, whilst fortunately quite rare, is a reality of kidney donation and transplantation, that sometimes they can be unsuccessful.
Yeah. Do you have anything to add, Paul, to that?
Yeah, I mean, one of our pairs once said that we're very much geared up for success and not failure, and I think the loss of a living donor kidney is obviously a big event for the donor, the recipient, and the people involved. I mean, we do, as Adnan says, talk to people about the likelihood, and there is a chance that when we go through the donor operation, there's never a guarantee we come out with the kidney at the other end. Very, very occasionally, there's some reason why we can't proceed with the donor due to technical issues or anaesthetic issues, and we do always mention that. I can think of one occasion over the last 19 years when that's happened in Portsmouth, and it's tough, but we've got to look after the donor primarily, and if it's not safe to proceed, we won't. No recipient has ever got angry about that. They completely understand. They see it as an amazing gift, and understand that the donor safety is always going to go first. And as Adnan says, you have to individualize the risk for each donor and recipient. Maybe slightly harder for a non-directed altruistic donor because they don't know where their kidney goes and to whom it goes to. But that's part of the counselling process that I'm sure Caroline is familiar with. That it really is an amazing gift for that reason, because you have no follow-up or can't expect any follow-up of where that ends up. So it's slightly difficult for them, but we hope that the donation will obviously be successful, and I'm glad to say in the vast majority of cases, close to 100% it is.
Thank you. Just another question on the Q&As from an audience member, Caroline, just asking, is there a risk of damaging the kidney when removing it by keyhole compared to open incision? That one's for Paul, please.
You actually bizarrely have a better view with keyhole surgery because you're much closer with the magnification of the instruments, and you do get a better view. I mean, any operation there is a risk of damage to the kidney, but from my experience, having done open operations and seen my colleagues do laparoscopic, I would certainly have a laparoscopic kidney operation if I could do. And actually, I think with the instruments that we use, it's actually the safer one. And because the incision's smaller, the recovery is quicker as well.
Thank you, Paul. I can't remember if you covered this, but there's a question about how long is somebody likely, I think you've said just a couple of days usually now to be in hospital.
Yeah, I mean, I would say that a few of our donors go home the day after, and the majority it's the second post-operative day, and very occasionally it may be a little bit after that. And that's the advantage of the keyhole surgery, that the wound is a lot smaller, a lot more comfortable, whereas historically it would have been 7 or 8 days in hospital.
Thank you. And a couple of questions we've had about what happens if something goes wrong for the donor, or they become unwell post-donation, or have a problem with their remaining kidney after donation, or they might need a transplant themselves. That's a lot of questions. But yeah, what happens to them then? Are they treated by their transplant unit or the normal NHS process? I don't know, Adnan?
I'll take that. And I typed a little response to that as well. So it very much depends on what the what the issue is. Obviously, for most of our donors, we would encourage them to stay under their kind of annual follow-up. That may be their transplant center, or it may be a kidney unit that's closer to them. And if there's a problem with, for example, blood pressure or your kidney function or anything like that, that will be dealt with by the kidney team. If, however, it's a completely different issue which is unrelated, that will go through the normal mechanism of being seen by your GP or being seen by a relevant specialist. I mean, if you fractured your leg skiing, the last person you want to kind of be trying to fix that would be your kidney specialist. So you would obviously go to your relevant specialist, but your local kidney team would still want to be involved with your care if you were to go see someone. And we're always happy, and we often do just get little queries from GPs and from other specialists to say, oh, we're about to do this, or we're about to prescribe this. Are you happy from a kidney point of view? And it's just, we're more than happy to always be contacted, because it's just a little bit of reassurance that people sometimes want. So yeah, if it's kidney related, it will be the kidney team. Anything else, it's the usual NHS process.
Thanks, Adnan. And just following up on that, so if somebody in the very unlikely event that somebody's remaining kidney, if they've got kidney failure in the future and themselves needed a transplant, there is a policy in place in the UK for that person to take priority within their own kind of group on the transplant list.
That's right. And yeah, so the UK and a number of other countries do this as well. If you are a previous living kidney donor, and if the rarity happens that you yourself need a kidney transplant yourself, at any point in the future, you receive priority on the national waiting list.
Thank you. So there's some questions about kind of following on from the transplant. So from your donation, sorry. So there's a question about pain and how painful it actually is. I'm not sure whether maybe I'm better placed to answer that one in terms of, from, I guess any surgery is, there's, once you have an incision, it's likely painful. From my own perspective, I felt my pain was managed very well. It was uncomfortable. I'm not going to lie. It was, I could feel it, and I was very conscious of my wound during my recovery. I think probably the most painful part for me, and I've heard other donors say the same, was actually when I got home, because I was then doing more. I think the kind of journey home was pretty uncomfortable. We hit a few potholes, I think, on the way, which kind of jolted the wound. But I went home, I think, with paracetamol, and that was adequate for me. So it wasn't the worst pain I've ever had, but it wasn't comfortable, but it wasn't terrible. And within a few days, I was kind of very happy walking around, taking short walks with paracetamol. I know everybody recovers slightly differently. I know some people get back to physical activity very quickly. Obviously, there are caveats around, just being careful about, as Paul was saying, what's happened inside your body, and being mindful of, making sure to take your time to recover well. But yeah, the pain was really well managed. I think there are different pain relief options when you're in hospital. If one of the medications doesn't suit you or makes you feel nauseous, for example, I think I was transferred onto a different one because it was making me feel sick. But it really wasn't that, for me. It really wasn't that bad. And I don't know, Caroline, I don't know if you've got anything to add to that in terms of your experience of other donors.
I think observing donors, the fitter a donor is prior to donation, their recovery is definitely better. So I counsel my donors to try and maintain a healthy lifestyle, improve the lifestyle. So there's like a prehab before donation, and that definitely helps in their recovery.
Thank you. And there's a question about whether a donor would have to take any medication after donating, but there's also a question which you may be able to answer, Adnan, about the current advice on ibuprofen, because I think we receive some conflicting advice from different units about is it safe to take ibuprofen after donation?
Yeah, so I mean, so firstly, with regards to do you need to take any kind of medications after donation? I mean, apart from kind of painkillers and things, which will be a short-term thing, no, there's no specific medications that you will need as a donor. Obviously, if many years later you were to develop kind of high blood pressure, things like that, then you would be on blood pressure lowering tablets, just like anybody else. With regards to ibuprofen, as a kidney specialist, even just for me, just to say those words, I kind of always feel like I need to cross myself. So I'm not a fan of ibuprofen. It's banned in my parents' house, for example. That's not to say that there's anything wrong with taking ibuprofen, and hundreds of thousands of people must take it on a kind of monthly basis. My usual advice to not just donors, but just some of the kidney patients, unless they have very advanced kidney disease, is my recommendation would be that if you can get away with any other painkiller, try that other painkiller first. If you've got a choice between, say, paracetamol or ibuprofen, really go for the paracetamol. If you really do need to use ibuprofen, then of course it is fine to take, but I would just take it for the shortest period of time possible. But my usual advice is to try and avoid ibuprofen, and if unless it's the only thing that really works for your particular pain.
Thank you, Adnan. So just looking at other things after donation, some questions around, essentially, is there anything that a donor can't do or shouldn't do after donating? Again, maybe for Adnan. Sorry, Adnan.
That's all right. I mean, so from my perspective, no, other than you can't donate your other kidney whilst you're alive, there really isn't anything else that you can't do as a donor. And I mean, obviously, once that early recovery period is over, people go back to their work, go back to doing the regular things that they were doing. Some of you may be aware of the British Transplant Games, where transplant recipients compete in sports, but they often also have, as part of that, a donor 5K run, where people who've donated a kidney, are running their 5K. And I mean, I remember, when it was in Birmingham. And I was the medical director for the games. I had donors outpacing me, and I just stopped after 1K and just went and sat in the pub while I was waiting for them to finish. And so, I mean, as Caroline mentioned, I think it's we do encourage donors to try and carry on with their kind of healthy lifestyles. And try to be fit and active. But no, I mean, there are no real restrictions to donors.
Do you have anything to add, Caroline, or does that cover everything?
No, I think that covers everything. Yeah, just the importance of checking blood pressure every year. I think that's my main take-home message to my donors.
I think we really encourage people to go to their annual follow-ups, because I think a lot of donors, because they feel so fit and healthy, think that it's kind of a waste of time, or they don't want to waste NHS time. But actually, it's really important, because what it also does is provide data and evidence on longer term follow-up of donors. So we really do encourage you to even that's through your GP over time, just to go and have those tests done every year.
I think that's really important, Jan, and I think it kind of also indirectly gives the reassurance to people that a lot of our donors do sometimes, because they just feel so well, and years later, of coming back every year and us telling them, oh, your blood pressure is fine, your kidney function is all perfectly fine. After 5 years, 10 years, they may think, oh, I really am wasting everybody's time here, but you're not. It's really important, to make sure that we do pick up the very small minority of people who may develop problems, and it could be 5 years, 15 years, 50 years later. But as Jan mentioned, it's getting that data as well, and the information that we give to people going through the process now with regards to long-term outcomes is really fueled by the data that we have. So the more donors that we have in the system, and the more data we have on them, the better it informs people who come afterwards.
Thank you. And there's a question
about Jan, sorry, could I just reiterate that? I mean, it's just so important. The donors have done such an important thing. We owe it to the donors to support them moving forward. And it is never a burden to see a live donor. We actually enjoy seeing them doing so well. So it is so important that they do keep up with that follow-up. You've invested in the NHS and your family by donating a kidney, and we offer that reverse back to you as a donor. So please accept the annual service that is on offer. It's really important.
Thanks, Paul. Yeah, and just on that, actually, that kind of cost saving, because there was a question about, obviously the tests and the follow-up of the donor costs quite a lot, but the donation saves the recipient, the patient, from being on dialysis potentially for many years. So there's a question about the cost savings, and I think there is some new data coming out about this, but on average, it's estimated that a living donation saves the NHS about £250,000 over the first 10 years after the kidney transplantation. So it's significant. When you add up the number of donors every year, there are about 1,000 living donors. So times that by £250,000 over 10 years, that's millions of pounds. So this is also an investment in not only in the recipient's health and lifestyle and quality of life, but in cost savings to the NHS as well, which I think is a motivating factor, particularly at the moment for lots of donors. We had a question about pregnancy and whether there's any impact on your ability to become pregnant, having donated either as a man or as a woman. Is there any impact on fertility? Caroline, maybe?
Yeah, you can have a baby after being a kidney donor. We would recommend you waiting 6 months to a year for your body to recover from the operation before trying for a baby. Potential donors of childbearing age are, however, counselled for the increased risk of high blood pressure and diabetes and urine infections during pregnancy, as Adnan mentioned earlier. So regular monitoring during pregnancy is really recommended, ensuring that the antenatal team are aware that you've donated a kidney and your living donor team are aware that you're pregnant. Some women do decide to wait until they've completed their family for these reasons and practical reasons before donating a kidney.
Thanks, Caroline. I'm just going to have a quick look at the Q&As on here. So we talked a little bit about, the fact that actually if you put yourself forward for assessment, you may be declined as a donor. And somebody was asking, what's the most common reason for somebody to be declined? Is it to do with their age? Is it to do with their medical history or mental health issues, or the kidney not being suitable? Is there a kind of most common reason?
I may take that. I mean, there's just, every person is an individual, and there's just so many different things that can crop up. And as we've all mentioned on a number of times, as much as we want the transplant to go ahead, the well-being of the donor always comes first. So most centres just have different layers of scrutiny. So sometimes we can screen people out just from the very basic questionnaire that they will fill in. So if somebody was to fill in that they have diabetes, for example, well, we will always say, well, it's a no, or recent cancers, or a variety of things where we can normally straight away say it's a no, and then people may have certain health conditions which just need a little bit of probing. Sometimes things just come up as a complete curveball, so people may be sailing it through completely fine, and then the final stage of the MOT, so to speak, is to get some X-ray tests done, CT scans, for example, and that may pick something up which we just completely weren't expecting, which can rule somebody out. So sometimes it's very, very straightforward. Ages come up again. Age is not the cutoff at all, but clearly the older we get, the more health issues we get. So again, it's always just a very careful risk evaluation, but I'm trying to remember the oldest living donor that we've had in Birmingham. I think they were possibly 83, 84. I mean, to be honest, they were fitter than me. So it's just, everyone is an individual and everyone just needs a very careful evaluation with regards to their risk.
Yeah. And I think it's very fair to say as donors that you are told that very clearly all the way through the process. You really do feel, or I certainly felt, and the donors we deal with at Give a Kidney, I think that your health and well-being is the priority. So I think it's really true that actually if there was any concern about this impacting on the risk to you being significant, then you would be declined as a donor. And very clear that actually that conversation is with you throughout the process. So if there were things that were flagging a concern, then they would be discussed with you. And equally clear that actually, as I've said before, that you can decide to change your mind at any point in the process, because things can change for you in terms of your life and what or maybe your relationship with the potential recipient. So there's lots of conversation around that through the process, and I often hear donors say, gosh, it feels like we're having to really battle to get through this process, and it's because actually the care team wants to make sure that this is the right decision for you. You're given plenty of time really to make sure that decision is the right one for you, and the kind of ongoing discussion around the things like how would it feel for you if it's unlikely, but if this transplant wasn't successful, what would that be like for you? How would you cope with that? Those are questions that you're really encouraged to think about and talk about as you go through the process. So I think your health and well-being is very much a priority, as everybody has said. So a question about non-directed donation. So this is kind of the area that Give a Kidney tends to deal with. So this is when someone steps forward to donate just because they want to donate their kidney to somebody who needs it, not to a specific person. In terms of the person who receives that kidney, what information would the donor know about that person, if any? Would they get to meet that person or hear from that person? Caroline, is this one for you?
So it's really important that non-directed donors have no expectations of finding out how the recipient's doing. A recipient may choose to write to their donor, or they may not for many reasons. And this doesn't mean that they aren't grateful. It just may mean that they feel too overwhelmed for them to put anything in writing. The donor can decide to write to the recipient, and if the recipient does write, these correspondence all go through the Living Donor Coordinator, and the Living Donor Coordinator will contact the donor recipient and inform them that they do have some anonymous correspondence and ask if they may wish to receive it. In some cases, if both the donor and recipient decide that they want to meet, then we obviously counsel them in making this decision, and will support them as a team to meet. So yes, they can meet, but obviously that is purely when a recipient and donor both agree to this.
And I think that's, in our experience, that's probably fairly rare. I think for most people, they may receive some correspondence from their recipient, a letter or a thank you card. Sometimes they do, sometimes they don't, but I think it's very much rarer that donors and recipients, donors who've donated as a non-directed donor recipients meet. It does happen. We know certainly of a few cases from some of our team at Give a Kidney, for example, but it's certainly not the norm. And again, it's about thinking really carefully about, is that the right thing for both of those parties? But there's certainly no expectation, and I think donors are counselled really clearly on there being no expectation of actually ever knowing anything about the person who received the kidney, in very much the same way that you would if you donated blood. It would just go to the person that needed it most. And then a couple of really practical ones, probably again for Caroline. So one is around, or it might be for Adnan, I'm not sure, about how soon can a donor drive or fly after donating. Maybe Caroline?
We've no set rules for driving, but normally we would recommend 4 to 6 weeks. I know our centre will say 6 weeks. And a donor should check with their insurance company before driving. Flying, again, if there's no complications after 6 weeks, again, checking with insurance. Is that what you would say, Adam?
Yeah, pretty much. I mean, with regards to driving, we'll often say 4 to 6 weeks, but as long as when you feel comfortable that you could do an emergency brake if you had to, that's probably the time when it's probably fine for you to drive. But again, yeah, just check with your insurance company or DVLA if you need to.
Thank you. And we had a question submitted in advance, which I think is a really interesting one. And it's about how do you broach, as a potential somebody who wants to donate, I guess as a non-directed donor, but potentially as a directed donor as well. How do you broach that subject with your loved ones? And I think it's something that we know can be really tricky, particularly for non-directed donors, because although the idea of donating might really make sense to you, it might not to the people around you. And it's something we hear quite a lot from potential non-directed donors, certainly around, I want to donate, but actually my partner or my parent or my sibling or child doesn't want me to. And I guess it's to do with, if suddenly you went and said, I need to have my kidney taken out for medical reasons, people would naturally be concerned. This is a surgery. So the idea of going through a surgery that actually has no physical benefit to you as a donor, it's really understandable that the people around you, are concerned. And I guess at the point that you're having that discussion, you're already much further ahead than they are in terms of your thinking and maybe the research that you've done. So I don't know whether we've got an answer to this. I think what people have found really useful in the past is, maybe sharing a webinar like this, for example, with your friends and family, making sure that you've got the literature about living donation, so that they can also become informed about, the risks, because I guess that's what people are really frightened of is, what if something goes wrong? What if something happens to you? Obviously, this is your decision to make, but your relationship with your family is also really important. So it isn't right for everybody. We certainly have at Give a Kidney people who've had that experience of talking to their families and taking them on the journey with them. But of course, everybody's different. Every family is different. Every person is different. So, but we certainly find that having, really clear information about, that this is a fairly common operation, what the benefit to the recipient is also really important. We talk a lot about risks, but actually the reason most people want to do this is because of the benefit, the life-changing benefit it has to the recipients. And I think a lot of people find that much harder to understand when the recipient is somebody you love and they love too. I think that risk feels less somehow. But actually, of course, the risk to the donor is exactly the same, whoever the recipient is. So I don't know if anybody wants to add anything to that in terms of advice about talking to friends and family. But I think it is really important that you have support around you when you're going through this process, and that's something to take into consideration. Caroline?
Yeah, I completely agree. That aiding recovery, having the family support there from the start, definitely is very helpful. Meeting previous donors and recipients, encouraging family members to speak to people that have been through it, can be very useful as well.
Thank you. And certainly at Give a Kidney, we can put you as a potential donor in touch with other people that have been through the process, or other people's potentially friends or family members who maybe struggled with it, because I think it's really hard to have your loved one going through a surgery that they don't need. I think that takes some getting your head around for a lot of people. So, and they are the ones, while you're asleep on the operating table, they're the ones who are maybe at home worrying about it. So, yeah, understandable. But yeah, we can, if it helps to talk to other people who've been through that process, we can certainly buddy you up with people. And often the transplant units could also do that if it's reassuring to talk to someone who's been through been through that process already. Let me just have a look. Oops. Just going to see if there's any more questions coming up. If anyone has any more questions to pop into the chat, please do.
Jan, the last question that's in the chat about how does a family decide who donates? If there are several options, if we've got time, might be an interesting one.
Yeah, please do. Go ahead, Paul, if you want to take that one. Or...
I think it's a joint effort between the living donor team, the medical team, and the surgical team. It's about maximising benefit, minimising risk, and from our point of view, you look at the genetic match between the kidneys, the donor and the recipient. Look at blood groups, whether it's going to be a directed donor, so the family member gives directly to the family member, or whether it needs to go through the sharing scheme. And also the potential generations, because if you're looking at a kidney transplant that's going to last 25 years and a parent or a grandparent wants to give a kidney, in 25 years' time, they may not be able to, whereas a sibling may still be able to. So it's just maximizing the options available. And every family is going to be different, but it's worth us putting the facts down. We will never tell you who should donate from a family, but we can certainly facilitate the information to allow a good decision to be made. There's never a wrong decision, but certainly a good decision. I don't know whether Adnan and Caroline have anything to add to that.
No, I completely agree with everything Paul said. Nothing much to add.
Yeah, I totally agree that it's a decision with the transplant team and with the family, that we can help support who will come forward. And we assess 2 people initially and then take 1 person to the next stages.
And there's a question here which isn't maybe directly related, but indirectly related. So there's a question about and I guess this is true for all of us, that we're hearing perhaps a little bit more now about living liver donation. I know this isn't your area necessarily, but certainly people who've donated a kidney as a non-directed donor are hearing maybe a few more questions around, well, could I do that as a living liver donor as well? I don't know if any of you have views on that. I guess it's asking for opinion, really. Do you have any thoughts on living liver donation, given it's not your specialism?
There are some areas in the world where it's done a lot more. The Japanese have a large experience because they don't, I think they still don't have a deceased donor program in Japan. So that's where the experience is. It is something that is becoming more common. There are a couple of liver units in the country that do it. And the numbers are tiny. I know we're approaching 4 figures for kidney donors in the UK. I suspect there are less than 20 living liver donors in the UK, but it is something that can be facilitated. I think on the whole, it tends to be directed at the moment from family members, particularly to children. But it's an expanding area, but that's probably at the limit of my knowledge as a kidney surgeon.
As a kidney physician, my knowledge is probably not much different from Paul's. I work in Birmingham, and we've got one of the largest liver transplant centres in the UK, along with King's. And as Paul said, the numbers for living donors who donate part of the liver is very, very small. And it's usually directed. It's usually, as Paul mentioned, parents and donating to children. So it is possible. We've spoken about risks and things. The risks after donating part of your liver are different, and they're a bit more significant compared to donation after kidney. So it would need a very, very careful evaluation. And the fact that someone has already donated a kidney may form part of the risk evaluation that a liver specialist would make. Again, it's not an absolute no, but as with all these things, everyone's an individual, and the liver specialist will do the same thing that we would do as kidney specialists, where we just go through the individual and look at what health issues they have. So it's a small area in the UK, but probably over the next 5-10 years may become a bit more common.
And I think as you've both said, it's a growing area. We will, it's certainly an area that NHS Blood and Transplant are looking at in more detail, and in the process of creating more kind of patient-focused resources to kind of guide people through that thinking process. So there will be more resources around living liver donation and non-directed living donation in the near future, and they'll be linked to from the Give a Kidney website very soon as well. So it's not the focus of today's webinar, however. Let me just have a quick look. Okay, so this is really difficult. So this is a question, somebody who's a potential recipient and their potential donor has stopped responding close to the end of the donation process. That's a friend, and they're saying they don't mind if they've changed their mind, but they don't want to lose them as a friend, but this has maybe impacted their relationship, and that's so hard. I mean, that's so hard, isn't it, to cope with when this is such a big decision for the donor, but also for the recipient to have that person potentially very close to the end step away. What kind of support is there through when something like that happens in the units? Caroline, is that something you can help with?
I think that reach out to your transplant team and your living donor coordinator. And obviously everything is anonymous between from a recipient and a donor. Information can't be passed, and everything is confidential, but talk to your team about your situation, and the living donor coordinator can reach out to the potential donor to offer support and advice to them. It is really tough. It's a really sensitive scenario, but reach out to your team, your local team, and they should be able to support you.
Yeah, really feel for you on that one. That's so hard. I think the sensitivity, the emotions that go with for the recipient or potential recipient and a potential donor, particularly when there's an emotional connection between you, because there are all sorts of reasons why somebody may not proceed, whether that's their choice or whether they're, for whatever reason, declined for, and there could be any number of reasons why they're declined, and you may not find out. But yeah, it can strain on relationships, and we've certainly heard donors who have wanted to donate and haven't been able to for whatever reason, just feel really devastated. So I think it is something that the donor, there's quite a lot of focus around that for the donor, but I wonder how much there is for the recipients, and the strain on the relationship can be really, really difficult. So really feel for you on that one, and really hope that you find the right way forward with your friend and for your transplants as well. So thank you for sharing that. So I think we're kind of coming to an end. I'm just going to look back on my list. I think we've kind of covered. Is there anything? Oh, hang on, we've maybe got another question. But whilst we're doing that, if there's anything else that the panel thinks that we might have missed, or anything else that we want to talk about. There's a question here about how long does the decision of the Human Tissue Authority, the HTA, after their assessment, how long does their decision making take?
Shall I take this?
Yes,
not long,
please, Caroline.
just a couple of weeks. So we can get it turned around. They within the report being sent to the Human Tissue Authority, it goes to panel, and it's a couple of weeks until we get the approval.
And we often find that, I don't know if this is your experience, panel, but we often find that donors are really quite concerned about the HTA because it's kind of a legal procedure that people feel really anxious about it. Certainly my experience, although I know that's not universal, is that actually they're just really there to make sure that you understand what you're doing, that you have the capacity to really kind of understand and consent to it, and that you're not being, they're there to protect you really, and to protect the law, to make sure that you're not being coerced or bribed, or there have been some stories in the media recently about people really being exploited as potential donors. So their role is really to make sure that the law is being followed and you're not being exploited or coerced or bribed into or paid to donate. So it's a very gentle, although it's legally binding, it's very gentle in my experience, and the experience I think of a lot of donors. So not really anything to be worried about. And you'll have answered all the questions they ask you many times before joining the process. So nothing to be concerned about. And the other one that people are often very concerned about, which isn't universally done, but it's done for non-directed donors and some directed donors, is the psychological assessment. And again, we feel, I think people really, if they maybe have had any history of depression or anxiety or other mental health issues in the past, it's something that people often feel really concerned about. So I don't know, again, Caroline, do you have anything to say on that?
Yeah, completely agree. It can be something that donors are a little bit apprehensive about. I reassure donors that it's not just an assessment process, but it's a support process as well. We're lucky enough to have some renal psychologists that are based with us, so they're very familiar with assessing donors and make it a positive experience, and as like I said, as a support through the process as well as the assessment bit.
Yeah. And I think it's maybe the word assessment sometimes that makes people a bit frightened, because yes, you are being assessed, but actually this is about making sure that the risk to you, both emotionally and physically, is as low as possible, and this is as safe as possible for you to do. So it's there to support you, and they will ask questions often around your what kind of social support you have at home, to make sure that you have kind of good connections and are well supported after surgery, because we often find that with donors, particularly if they're donating to someone they do know, that for the recipient, this has massively increased their health and well-being, but for the donor, obviously this does, in the short term, you are in a bit of pain, and your body has been through surgery, so there can be a little bit of a kind of anticlimax, I guess, after building up so much to the surgery, those few days, and when you get home it can feel like a bit of an anticlimax, and your recipient can be feeling 100 times better than they were before, but you're feeling a bit worse. So that kind of emotional support's really important, as well as the kind of looking after the body. Yeah, I don't think there are any more questions. Is there anything else from the panel that you think we haven't covered that might be useful?
No, I mean, I would just echo that last point, that donation, whether it's directed or non-directed, can be a real emotional roller coaster for people. And I mean, we've got renal psychologists. Sometimes services are a little bit stretched, so that the focus does go on the non-directed. But I think ideally, anyone who wants to be a living kidney donor should really have that psychological assessment, for lack of a better word, because I think it's just support, and it's just making sure people have that support structure and kind of coping mechanisms, because it is there's always highs and lows, and it can just be so unpredictable.
Yeah, definitely is a roller coaster. So Give a Kidney are there to support as you go through that process. We can, as we said, we can kind of buddy you up with other people that have been through that process. There are also some really good I think online kind of forums on the social networks where you can kind of meet and hear from other people who've been through the process, or maybe been declined, because I think that can actually sometimes be much harder than actually going through the process. So do check in with other people through that process. I think we'll probably wrap up there for today, but just would like to thank you all for joining us, and thank you for such interesting questions. If you have any burning questions after this that you didn't get to ask, then please do drop us an email through our social networks, or The email address is info@giveakidney.org, and we'll certainly ask one of the panel if we can't answer the questions to answer them for you. But also, as I said before, Give a Kidney does support donors going through the process. So do get in touch with us if you'd just like to have a chat with someone who's been through it, or particular questions that you don't particularly want to ask your team or are not yet with a team. We're very happy to hear from you and support you wherever we can. Someone's asking, will there be subtitles on the playback? There will. It usually takes us a week or two to get this video kind of edited and subtitled, but it will be on our YouTube channel. And if you do follow us on social media, we'll put a note on there when it's up and live. But all our other webinars over the last couple of years are on there too. So if there's anything else you're interested in, do go and have a look. If you're watching on YouTube, do like and subscribe to the channel. It helps us to get the information out to other people like you who might be interested in living kidney donation. So I think that's probably all from me. We are a charity, so most of our income comes from people like you who donate not their kidneys, although we would like you to do that if you feel comfortable, but donate a little bit of cash to us to help with the running of the charity and help us organise events like this. So if you do feel that way inclined and could maybe fund the cost of a cup of coffee to us, we're always very grateful. You can do that through our website or on Facebook or through our Just Giving page. So we're always very grateful for any donations. We'll be adding more webinars later in the year, so please do subscribe to our newsletter on our website to hear more information about future events. We've got lots of exciting things happening this year. We're expecting the 1,000th non-directed living kidney donation very soon, so we'll be celebrating that probably over the summer months, we hope, all being well, which is a huge milestone, I think, for the UK and for Give a Kidney, obviously. And we have one of our supporters, Dennis, who's also a living donor, organising a long-distance 500-mile cycle ride called the Transplant Tour, which will take in 7 transplant units. They're cycling from Edinburgh to Oxford in September around Organ Donation Week. So that just shows you that I think Dennis is in his 70s, so he's quite capable, and he's a donor. He's quite capable of doing a 500-mile cycle ride, which is very much more than I could do. But he's very much looking for people who are cycling fans, cycling enthusiasts to join him, and we'll be celebrating some of those transplant units along with them as well. So that's all from us today, but thank you very much for joining us. Thank you once again to Caroline, Adnan and Paul for giving up your Saturday morning and giving us such insight and support. We really appreciate that. And we'll end it there. Bye everybody. Thank you.